New charges against the former Olympics doctor already charged with sexually assaulting teen girls. The feds say Larry Nassar had child porn in his possession. Jermod Terry is
Bill Cosby, Harold Shipman, Theodore McCarrick, and many more throughout history have abused their rights and betrayed the trust assumed for professionals of their caliber, all in service to twisted or horrifying fantasies. Perhaps none as much as those of Larry Nassar, the formerly respected Olympic-level osteopathic physician and professor at Michigan State University, revealed himself an ephebophilic serial sexual molester hid in plain sight for 20 years.
Sorry.
I'm Andrea Munford.
Hi, nice to meet you, Larry Nassar.
Thanks for coming in so quick, too.
Yeah.
Obviously, you're not under arrest, so you can leave whenever you want. Anytime we bring someone to interview room, we make sure that they know that. I know you talked to Val O'Brien, one of my colleagues,
Yeah,
a couple
wow,
years ago.
right.
Now,
Okay.
what I want to talk to you is kind of go back to that situation. Sure. And I know that you guys had, papers on there, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
Right, that had, concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it, from a manual medicine standpoint. And there was a student that was in the room that had to leave to start because I was behind. We need to start another patient. And so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay. What practices have you changed in response to
I've been trying to have people in the room, and trying obviously not to get into that same situation. You know what I mean?
When watching this video, please keep in mind that guilty suspects often feel the need to over-explain the story to alleviate tension and try to persuade the detectives.
Has there been another complaint? I'm just confused right now.
Well, we're kind of seeing what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that, and having students there and having family members there, and I document in the chart, so-and-so's in the room, so my documentation's changed. I'm trying my best to do it over close, and that's sometimes the hard thing is the tightness, it's like the close gets in the way, but so I'm very, there's not a day that goes by that I don't think about that, because that was a very scary thing, in my life, obviously. So, and I don't want to get into that. So I was like, oh my God, what happened? My heart is hurting. It's like, what the heck? So, I hope, that I've made the appropriate changes. Because it's, and I've done a lot of education. I'm really trying hard at educating so that and I always thought I was good at educating, but I'm trying to educate even more.
What do you mean by educating?
Explaining what we're doing.
To the patient?
To the patient, family, exactly.
All right. Have you had any instances where there hasn't been anyone in the room for an exam? There'd
be some on occasion, of course. You know what I mean? That just is the way that with medicine is now. It's difficult. You know what I mean? So yes, that has happened.
And what circumstances cause that to happen?
The patient is an adult, like she was too. But again, when I'm doing that, I'm trying not to do those techniques. You know what I mean? So, but I'm trying, really trying to explain things, and I haven't had any complaints. You know what I mean?
During that technique, though, has there been situations where someone's not in the room?
I would probably who's a doctor. You know what I mean?
The following section of this video is Larry Nassar's first attempt to pull rank and use his social status and education to talk his way out of trouble. He explains to the detective a maneuver called Coccyx manipulation. This maneuver can sometimes include a gloved finger entering the rectum in order to manipulate the tissue. At that point in the interview, Nassar was most likely hoping the detective would take that statement on face value and allow him to leave due to three things. The first being his social status, and the level of trust that a professional of his standard theoretically must deserve. The fact Nassar at first glance was a family man, a loving, down-to-earth American. Finally, the detective's own lack of knowledge on the subject. Two things that Nassar had failed to predict are the sheer amount of research the detective had completed in preparation for the interrogation, and the fact she has countless victim statements testifying Nassar entered his patients vaginally. This is not necessary for Coccyx manipulation.
You do that technique on.
She said it saved her career, you know what I mean? So she was just in today.
Can you explain the technique?
Yeah,
know
yeah,
bits and
yeah.
pieces,
So,
but
and I sent her videos, you know, too. I mean, like,
Yeah.
I lecture on this. That's the thing that's frustrating. It's so, you know, the sacrotuberous ligament, it runs from the pubic symphysis, the falciform process. It's like the pelvic floor. Okay, you want to understand the stuff. So you're really coming in, and like the way to describe it, you know, even in some of the videos is, it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release, and that's a great teaching thing too. It's like I have the student feel their rib cage, okay? And then I go and I release that, and they're like, oh my God, what did you just do? You know what I mean? Because they can feel that effect, you know, from the way that the costellomus muscle, the costellomus thoracis runs down from the rib cage into and entwined in the sacrotuberous ligament, you know?
So when you're doing that, and you said you look for the release, what are you feeling? Like, what does...
You feel tissue tension.
Okay.
Tissue tension changes. It's all about tissue tension.
Right.
And so you're trying to, like, if I pull on one part, you know what I mean, like, you can see how that affects another part.
Right.
So it's the same thing like a run in the pantyhose or something like that. You know, like one pull here can affect, and we talk about triplaning and fascial releases, where, say, if I rotate, extend, and back, you know what I mean, that, like wringing out a towel. You know what I mean? So there's, you know, you may have to go clockwise, counterclockwise. I always talk about the different vector forces to make the effect above. You know what I mean? So it's a three-dimensional, you know, I call it triplane, but like a three-dimensional effect to it, because it's not just that simple. You know what I mean? So.
Gotcha. Okay. Now, how long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s. You know what I mean, like early 1990s.
Right.
You know, and I've made videos very clear. You know, and I've lectured. Oh yeah, you know, and I've lectured.
Are those online anywhere?
They're on my G drive, like I said, that I've sent. You guys should have all of that.
Dropbox. Or
Yeah, you know, it might have been Dropbox
then.
then.
Back then,
Yeah,
just a few years ago.
Yeah.
So how would a patient be laying to get that treatment?
Prone, and then they're laid prone, you know, and then you're doing that, and then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So yeah, you can do, but
Would they be on their side?
on their side.
Yeah.
Yeah, you can do it on the side too. I mean, like I show them in all the different directions, but it's rarely on the side. It's more if I'm doing something on the side, that's more for the SI joint. That's the SI joint.
What's the SI joint?
Sacroiliac.
Okay.
Right here, you know,
Right.
so that's where I might be like lifting. You actually sometimes like lift the hemipelvis.
Okay. And so where on their body would you touch them?
Here would be, if your hands are like this, you know what I mean, you could be actually holding that, like this would be up towards the back, and this would be up towards the pubic symphysis, and you could be like a U shape, and you can lift and shift from that position on the sideline. Generally, with the sideline, that's the lift and shift, and the coccyx. You know, if there's a coccygynia, you know, problem, then sideline, you know, can be treated sideline.
Okay. All right, but you wouldn't, like if somewhere on the side, you wouldn't be doing the same.
There'd be an alteration. There'd be a variation. You got to adapt, like just like standing. You know what I
Right.
mean? Like so, you change it because of the three-dimensional vector forces. Depending upon whether what position they're in, it's going to have a different effect. So normally you try it one way, and one way doesn't work. Then you try to seat it. You know what I mean? Because of the way that you can affect. And I try and teach them if it works. I've taught a lot of patients how to do it themselves.
Okay.
You know what I mean? Like self-treatment. Like okay, I told them it's like giving themselves a hand wedgie. You know, it's like reach and pull, reach and pull. Like you're picking a wedgie, you grab, and then you pull off to the side, or you pull front, or you know, one of those three main vector forces is.
Okay. Would this ever involve like digital anal penetration?
Only if we're doing a coccyx,
Right.
problem. You know what I mean? So if there's a fractured coccyx or a coccyx disorder too,
Okay.
so that you can come perianal because it comes up, when you have the pelvic floor attachments, but you can come to the pubic symphysis and also towards the coccyx. You know what I mean? So it's your lift, I call it the lift and shift, when you're doing that, So that's a very common to do one side or the other, and that's the straightforward. So like if you're here, here, or here, there's 3 different vectors, and that would be the straight vector. Like if I'm doing ribs a lot, then I would be going straight.
Okay. All right. Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And
Up until this point of the interrogation, Nassar has expansive body language with heavy use of hand gestures to portray his view. However, when he is confronted with the first accusation, he tucks himself into a ball and holds his own hand. This body language is often seen when someone is feeling immense pressure and extreme nervousness. Could this be because he doesn't know how many women have come forward to accuse him?
it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm
Okay.
from your typical treatment.
Okay.
This would have been
Wow. Okay.
and she was receiving some of that type of treatment, but then
Okay.
there were also some other ways that she was touched that should
Okay.
be on the treatment.
Okay.
So that's why I'm asking about anal penetration.
Only if there'd been coccyx, and I would have, and it would have been, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like unless I was purposefully treating the coccyx itself.
Okay.
You know what I mean?
What would you use to do that? Like what digit or what part of your hand would you use?
Well, normally I'm using my thumbs once I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside.
Okay.
To
Do you wear
manipulate
gloves
the
when you do
coccyx.
this?
If I'm going to go intra, yes. You know what I mean? So.
This was a long time ago, so I don't know how many of your patients that you remember from back
Right.
then.
Yeah, I don't, how many patients, right. Yeah, no, I don't remember,
Right.
No.
Well, this is a little bit of a personal question, so
Yeah.
I'll just be totally honest with you.
Yeah.
I mean, you have these young girls, and they're
Right.
athletes. They're
Right, but they're usually with their parents. They're usually with
Yeah.
their, parents, So that's why I explain a lot. you know what I
They're
mean?
athletes. They have
Right.
lovely figures.
Right,
They're very cute girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah, like do you ever get an erection?
Well,
Or,
obviously you don't, you know what I mean? So
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right.
Okay.
Well, this is why I'm talking to you about this,
Yeah.
because this young girl and her mother both observed this on more than one occasion during treatment.
That I would get aroused during an exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that because that should, when I'm working, I'm working. You know what I mean? So I don't.
Well, you can understand why this would be
Well, yeah.
her concern.
Yeah.
That you didn't wear gloves.
Right. Okay. But I mean, but it was like doing her coccyx. Actually digitalized the coccyx, like for a coccyx treatment.
The words that she used were he anally penetrated me with his thumb.
No, see that wouldn't have been. See, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating. It's pushing off to the
So I
side.
penetrated her. Okay. Again, this was some time ago.
Yeah, but I'm lifting up and I mean it's not going inside her rectum. It's lift. You can get there's a lot of soft tissue there, and you're lifting through there. I would not have. I would be wearing gloves if and I would be using this finger. Okay, when I'm using my thumbs, I'm lifting. You know what I mean, to try and separate the tissue and releasing through there.
And this is what you're describing to me is very different than how she's describing her experience.
Okay.
All right.
Okay.
That there was no explanation of what you were doing to her or to her mother. And so you can see kind of the consistency from what happened a couple years ago.
Well, no, but, okay, but I mean, okay, but I would be, I mean, like, that's why I have so many lectures and stuff. I mean, that's what I'm known for is my education. You know what I mean? So I don't.
Your education to
students.
To students,
Right.
but not necessarily
To patients. Well, I try to. You know, I mean, like I am. I'm like, I've never had anyone, you know, what's confusing to me about is why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient.
Okay, put yourself being a teenage girl.
Okay.
All right.
Okay.
Most people that are sexually assaulted are very uncomfortable. They don't know what to say.
Okay.
They're in a position where they feel.
But the
all
parent,
sorts of
the parent
emotions.
was right there. You said the mom was there.
She was in a different part of the room. She couldn't observe.
It's just,
I mean-
it's an exam room, a different part of the room. It's the same room.
Behind where you were.
Okay.
But I don't think that really the focus is why is it being brought up now. I think
Well,
the
you want to know, I'm
focus
just
is
trying to think of what.
that it has been brought up, that
Right,
there are
right.
discrepancies in what she's
Right.
telling me as compared to the technique that you're describing.
Well, yeah, but I'm trying to think of, I mean, you know, this is trying to think of what I would have been doing differently. That's a long time ago, you know, I mean, for me to remember everything, but there would be, like I said, what the discrepancy would be is I'm using my thumbs, that's not a discrepancy, to release around the coccyx, okay, where I'm actually lifting, okay, so that's what I said, if I'm treating through sacrotuberous and not the actual, because I'm trying to release the tissues that come up to attach there, so I am pushing hard, okay, with my thumbs, okay, and I'm separating. Okay, so if you have thumbs over there and you're separating, but I'm not going in, if you're going inside you're going to be using your finger, okay, not your thumbs, and that's consistent with what I'm saying with what she said. So if I'm saying yes, that I'd be using my thumbs, how's that inconsistent?
Well, if your fingers, and pardon me, gesturing,
Right.
are doing some type of.
But my fingers are up here, my thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb
Uh-huh.
anally penetrated her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once, on more than one treatment.
I'm just working the floor, you know what I mean? But I would not be. How would I be putting my thumb and fingers, you know, like that? That would not be correct. You know what I mean? I am.
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would you
And
touch her breast to do the ribs? I mean,
You
demonstrate
move-
on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Okay, so you're lifting and shifting again because you're moving the tissue out of the way. So if I'm moving tissue out of the way, I got to get down to where I'm making contact, you know, with the rib. Okay, so you try and move and adjust. Okay, or the same thing here. If I'm on the head coming down, you're pushing down, or if you're off to the side, you're pushing off to the side. But you're you know, there's ribs that are underneath that area, so you're trying to slide through and across.
Okay, that
And
makes
then-
sense.
Right.
But this girl saw you 5 times,
Uh-huh.
and all 5 times there was something that, with her knowledge of what that treatment was, because she had some knowledge of it,
Uh-huh.
went beyond that. The
Okay.
touching of her, the digital penetration of her anus,
Mhm.
touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your demeanor, your behavior, your physical reactions, and being able to see an erection.
Okay.
Okay, so you know, I know it was a long time ago.
Oh, right.
I'm here to get your side of the story because this
Right.
is very concerning.
Well, yeah. I mean, I try my best to be appropriate, professional. You know what I mean? And I have no understanding of why that would be occurring. Okay, like yeah, I'm male. You know what I mean? But
Has it ever happened in an exam or treatment before?
You know, I mean, you are, you know, I mean, I'm focused on my treatment. You know, I mean, I'm not trying to gain any type of sexual pleasure out of working with my patients. Okay, I mean, that's what you're trying to ensue or whatever.
That's what I'm asking you.
Right, and I'm saying no, I don't get sexual pleasure out of working with my patients. That's not what being a physician is. Not what I'm about. Okay, what I'm trying to do is release tissue and work through them, but I'm not trying to get my, you know, like my jollies out of this. Constantly discussing that with them. You know what I mean? Like, does it help?
What would you say prior to doing this treatment?
What would I say prior to doing the treatment?
You're at a doctor, someone that you trust, and all of a sudden, his fingers are essentially in your vagina.
What?
And with no explanation.
I would have explained it. I don't understand why she said I didn't explain it, because I always explain, okay, now you're going to
But
feel
you
like
didn't
pressure.
explain it 2 years ago.
Yes, I did.
I mean, 2 years ago, she reported pretty quickly after it happened. She's not going to forget that she received an explanation.
But I do explain. You know what I mean? That's what I'm saying is like, you know, I don't, that's my, I'm like, okay, I'm putting pressure, compressing, separating, you know what I mean? Like I'm going to, you know, my hands are going to be pressing on you here, and I'm going to be pushing off to the side, or, you know, if this hurts, let me know, you know, but I'm treating it and just talking at the same time. You know what I mean? So as I'm going through it, it's not like I sit and explain everything to start with and then go do it. I'm talking through it too. You know what I mean? It's like, how does that feel? I'm getting real-time feedback from them. Okay, so as I'm doing it, like, you know, is this hurt? Are you okay? You know, is that feeling better? Okay, so it's not like it's a dead silence and I'm just doing things. You know what I mean? I'm constantly talking, you know, with them to get feedback. Okay, did they say anything about that? You know. But that's what I do. I'm constantly talking. You know, does that make it feel better? Make it feel worse? And I'm adjusting based upon that.
Would there be a situation that you wouldn't wear gloves during an exam like that?
If I'm you know, like I will wear gloves if I'm actually like manipulating the coccyx. You know what I mean? Because you're going into rectal. You know
What
I mean?
if you're going vaginally or even just outside?
Well, if I'm just outside, no. You know what I mean? Yeah, I even say that on the thing. You know, as long as you're staying external, you know what I mean? Because you're external, okay? And you're sensing, you're using to push, to lift and shift. You know, because you're staying. You know what I mean? Like you're staying lateral to that. So you're pushing in central and then lateral. Okay. So, but you know, so if you have like the vagina here and you come in here pushing, you can see how you could, you know, like feel, or they may have as a teenager having that sensation, but I'm not going intravaginally. I'm going extravaginally, but pushing in through the pelvic floor. Okay. So this is the pelvic floor. You know what I mean? You're here and coming over. There's tons of room there. Okay. And so that's what I'm saying is like, that as I'm doing that, I'm asking them, you know, are you okay? You know, am I pushing too hard? You know, is this hurting? You know what I mean? Do you feel better up there? Am I monitoring hand?
Did you ever ask them if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, you know, because I'm trying to see, okay, do I need, remember I said about the different adjustments, because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. You know what I mean? And are you okay? You know what I mean? That's the thing that's very irritating to me, you know, is that if I'm asking the patient, you know, for feedback while I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? You know, like you're talking in real time, you know, with them. Okay, am I pushing too hard? Is this hurting? You know, like this, because you know, you don't want to push too hard to hurt them. You know what I mean? So, you know, does that feel better? Feel worse? You know what I mean? And then they respond. You know what I mean? I mean, I hope. You know what I mean? So, but that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication. You know what I mean? But when you're talking to them in real time, you know what I mean? Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them because they had no prior explanation, I mean, would a girl that young speak up?
When you're trying,
if she's wondering, if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people don't speak up.
I can see that, you know, but
And then seeing that you're erect and feeling, on more than one occasion, and feeling very uncomfortable.
yeah, well, it'd be nice if I had, you know, whatever. I mean, I can't speak for her, but if the parent also and her felt that, it'd be nice if there was some communication where I'm asking for communication. You know what I mean? So, but that's.
And we can't go back to having that.
Right.
But this situation as it is, I mean, there are some things that, even to me, hearing you explain it one way and hearing how she explained receiving the treatment,
Right.
is very different.
You know, I mean, trying to
Well,
explain it, you know what I mean, the best that I can.
right.
You know, I mean, I'm trying
But
to.
for her, she very vividly, you've done it hundreds, maybe
Right,
thousands
right,
of times.
right.
Her, she had done it 5 times, and it's very vivid to her
Okay.
how she received
The
what you
treatment.
presented as treatment, what she felt very different as.
Okay. And did she ever make any, I would assume not, otherwise I would know, you know, like concern, you know what I mean? Like, did I ever like ask her something and say like, does this hurt, and then not adjust it or not listen to what she was saying? You know what I mean? Like the feedback, would I respond to her feedback? And was she
In a few seconds, the detective will deploy the silence technique. This is a commonly known tactic in interrogations when the detective wants the suspect to divulge more information, but he doesn't want to directly accuse the suspect at this time. Guilty suspects will usually find the need to break the silence as the tension becomes too much to bear. It also non-verbally lets the likely paranoid suspect know that she still doesn't believe him.
was she telling me she was getting better? Well then, yeah, I mean because that's how I'm asking, you know, like for feedback. I want to know, you know what I mean? Am I helping? Am I not helping? You know what I mean? And that's and it's made like I said, even with be able to continue standing and walking and doing our job. You know what I mean? It is very personal. You know what I mean?
And it's also received very different when you're doing it on someone from the medical profession who has a lot more knowledge of what you're going to do.
Right. I can't talk about something I don't know the situation. You know what I mean? Like from that long ago. But that's what I try. I do this all the time. You know, I talk to people. I'm trying to get feedback, and I'm trying to go off of their feedback. You know, and there's like this trust too on my part of that I'm trusting them to tell me if I'm hurting them, if I'm pushing too hard. Are they getting better? You know what I mean? Like that's part of the only way that I can really know, you know what I mean? It's like, is by having the feedback, you know what I mean? And I hope they said that I was asking them and trying to ascertain how the comfort level is, you know what I mean?
In some ways.
You know, because that's, the last thing I want to do is hurt someone, you know what I mean? And so if you're concerned because you're in their private area and you're asking them questions, and if they're not giving you the feedback, then how do you know that if you're saying, am I hurting you? And they say no, then how do I know that I'm hurting them? You know what I mean? And I'm trying to be realistic with them, you know what I mean? You know what I mean, is to help them, not to hurt them. You
And
know?
so, just to clarify, you're saying that during these visits, these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive, that you don't get aroused when you're touching. I mean, you're essentially touching their genitalia, touching their breast.
You know, I'm not purposely trying to get arousal from doing any treatment. I mean, come on. You know what I mean? I'm not purposely trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay, you know, if there was arousal, it's I mean, like it would be because of whatever, I don't know, but I'm not trying to. You know what I mean?
I don't know.
Well,
I don't
you
know.
When you're a guy, sometimes you get an erection. You know what I mean? But I don't. That's
You get an erection when you're aroused.
Throughout the interrogation, the detective has done extremely well at getting her questions through to the subject in as little words as possible. This prompts the suspect to over-explain himself and gives the detective more chances to cross-examine his story and look for flaws in the extra detail.
But I mean, like I'm just saying that, I'm not trying to, how do you say this? And if I had an erection, I don't understand why I would have an erection from doing the treatment, from what I'm doing, okay? Mm-hmm. And that's rather embarrassing, I mean? It'd be rather embarrassing, okay? I mean, to have that happen, okay? So it's just like, that's not appropriate, okay? And that is just not professional,
Outspoken Michigan judge became an overnight sensation when she lambasted USA Gymnastics Dr. Larry Nassar at his sentencing.
I wouldn't send my dogs to you, sir.
He'd gotten away with it for a long time.
Nobody listened. If one person would have listened 30 years ago, hundreds of girls would have been spared.
She decided to allow any victim who wanted to speak. It turned out to be 156.
I know the truth, and I know I'm worthy of sharing my story. Much as it was my honor and privilege to hear the sister survivors, it is my honor and privilege to sentence you. Because, sir, you do not deserve to walk outside of a prison ever again. You have done nothing to control those urges, and anywhere you walk, destruction will occur. I find that you don't get it, that you're a danger. You remain a danger. I am a judge who believes in life and rehabilitation when rehabilitation is possible. I have many defendants come back here and show me the great things they've done in their lives after probation, after parole. I don't find that's possible with you. Your decision to assault was precise, calculated, manipulative, devious, despicable. I don't have to add words because your survivors have said all of that. I don't want to repeat it. Sir, I'm giving you 175 years, which is 2,100 months. I just signed your death warrant.